you kind of mentioned bringing peers into Ramsey County, and obviously you've been a huge advocate for peer support here.
Oh, yeah.
What do you see as the benefit of peer support, and why are you such a big advocate?
Yeah, so peer support fills a gap in care that I think's been missing for a long time, and I think where that gap was created was when the effort was made to professionalize addiction care. Insurance companies would only pay for people with professional credentials, either degrees or certifications or licenses in addiction, and there wasn't a space made for people with lived experience other than to be counselors or in that capacity, but a role for people with lived experience to walk side by side with someone who's going through that and take the time to listen to them and offer them support in ways that weren't necessarily, weren't trying to tell them what to do, but to support them. And so I think that piece of addiction care was missing by virtue of how it evolved. So when we started to recognize that people with lived experience and some training in how to work with people with addictions could be included in the mix, I think it was a eye-opening experience for a lot of providers who saw the benefits in that. And we were one of the early ones to recognize the benefits of that in that detox center, because when we brought peers in, it calmed the whole facility down, the clients, the staff, everybody, because it gave the clients someone to talk to openly about their experiences and what they were going through. And I think too often in healthcare, we rush people through, we ask them a lot of questions, and they go to somebody else and they ask them the same questions, and they get jaded to it. And I think having peers, someone that you could develop a relationship with, maybe long-term even, that would support you through all of this and listen to you, I think that was the missing link.